So I want to quickly touch on how the media report on drugs and drug users. Just while I researched for this show, I came across 3 articles which refer to safe drug consumption rooms as either shooting galleries or fixed rooms, which definitely has connotations of some underground, illegitimate rundown house, whereas as we've seen, these would be medical facilities run by professionals. Also, the use of images like these contribute to the idea of unsafe and illegitimate practices, and also conjure up some sort of visceral reaction. I mentioned that the Scottish Affairs Committee recommended a decriminalising of possessions of small amounts of drugs for personal use, so I want to explore the arguments for and against decriminalising drug use. Arguments for decriminalisation include that fewer people would be imprisoned for possession of drugs, which would ease overcrowding, and possibly save money by not housing so many non-violent offenders. The inherent danger of various drugs is also a significant argument for decriminalisation, or at least the questioning of the legality of other drugs like alcohol or tobacco. In 2009, David Nutt, a neuropsychopharmacologist, was sacked as the government's drug czar for releasing research showing that LSD and ecstasy were less harmful than alcohol. If you trust this scientific research, then it's a considerable point to be made for decriminalising drug use. And another argument for decriminalising is the lives saved. In 2001, Portugal became the first country to decriminalise the possession and consumption of all illicit substances. Since then, it's seen dramatic drops in overdose and HIV deaths, as well as drug-related crime. As for the against arguments, a lot of arguments suppose that drug use is wrong, and by decriminalising it, we're sending a message that it is right. This argument can be quickly rebutted by the many other things that the majority of us agree are wrong, but we're not advocating for criminalising, like breaking a promise or lying. Another argument would be that since heroin produces such a pleasurable experience, more so than anything else, that the use of heroin would increase if decriminalised. However, again, this can be potentially squashed by Portugal's dramatic drop in overdose deaths. So if more people are using heroin, a very small number are dying from it there. You only have to look at the drug use trends of Portugal's population to see that less people are using cocaine, amphetamines and MDMA. So decriminalising these drugs has not led to an increase in use. And lastly, another argument concerns children and young people, with the idea that if cocaine and heroin, for example, are decriminalised or sold over the counter, it would be easier for them to obtain it. However, in some areas, it has already been seen that it's easier to order cocaine than pizza. So surely if these drugs are in the hands of professionals or medical bodies, it would actually be harder for children to obtain them. Now let's move on to COVID-19 again. How has COVID-19 affected those addicted? Well, firstly, opioids negatively impact lung and heart health, so people who use opioids at high doses may be more susceptible to COVID-19 and the illnesses may be more severe. We also should remember that those currently in treatment may be challenged by physical distancing measures. Self-quarantine and other public health measures may disrupt access to medications and other support services, which means a relapse is much more likely. Not just relapse, but if social distancing measures are in place, if someone who lives alone were to overdose, the likelihood of someone being present to administer naloxone, which prevents overdose deaths and saves lives, is small, meaning we could be facing more overdose deaths as a result. If you're struggling with addiction at this time, there's a wide range of resources which can help, like the NHS, Crew 2000 in Edinburgh is still providing help via phone, and specifically if you are using drugs during this time, there's a wide array of advice on how to do so in a more hygienic way to reduce your risk of catching COVID-19 at the Crew 2000 website. After talking about all that, drug policy, safe consumption rooms, the media's portrayal, decriminalisation, and how drug users cope with these policies, maybe we should ask why drugs were made illegal in Britain and Scotland in the first place, as well as how to treat those who are addicted now.